Hi, I'm Tom Mason, one of the pediatric rheumatologists here at Shriners Hospital. Most children that come have juvenile arthritis or versions of that, but many of the children are evaluated here who may have something that looks like that, and so many of them don't make the diagnosis. Our diseases are sort of uncommon, relatively obscure, and many people in primary care have not had a lot of experience in their training with them, so many of the evaluations are for symptoms that are unexplained rather than a clear-cut diagnosis. We have wonderful diagnostic, we can do lab testing, we have imaging, we have some of the best rehab services, physical therapy, occupational therapy, splinting prosthesis, and then great orthopedic surgery coverage if we need it. Fortunately, we don't need it a lot with kids with arthritis. Depending on the nature of the problem, many of them are going to have some testing. Some of that is laboratory testing, some of it is imaging. We get some survey information because we want to have a way to keep score and measure how they're doing. Then they'll often go to the lab and get some testing. And then most of the time then there'll be follow-up visits. Often therapists or social work or some combination thereof will almost always visit with the families. Clarity, even when it's not arthritis, is probably our best therapeutic maneuver in a lot of ways, because there's a lot of information out there and people, their children are not doing well, and the uncertainty factor creates its own kind of problems. So yeah, clarification I think is probably, whether it is an arthritic diagnosis or not, is really, I think, well received by families. I think the sort of mortar between the bricks here is really what makes it the place it is. If we need help, we just ask somebody. It's not a formal process and everybody's kind of on the same page. We've all walked across the hall and asked somebody for some advice or consultation or whatever, and so that's great, but I think it also gives family a sense of communication.